Hey, everybody, welcome to another episode of the Exercise Mechanic Podcast. Today, we are going to be talking all about assessments with the Exercise Mechanic team, Brett Patterson and Ryan Taylor. Gentlemen, how are we doing today?
Very good.
Rock and roll.
Yeah, good, man.
Excellent. Feeling better now that your microphone is working and we're ready to rock and roll.
I was ready to use my laptop as a Frisbee, so.
That's right. And I mean, you do have a background. You played Ultimate Frisbee in the past, so you probably throw that thing quite efficiently with or without a UCL.
Yeah, pretty sure. I think I've thrown it 80 to 90 yards, like a disc.
That's not
I don't
bad.
think the laptop's going to fly quite as far, but it'll explode. So that's what I was going for.
Frustration is a very, very powerful fuel. And when mics don't work, frustration runs high. So who knows? Maybe it would have been a PR with a laptop. As we kind of start to get into today's conversation, we're going to open up with some smoke. The elephant in the room. Are assessments overrated? Yes or no? What do you guys think?
I'm going to say they're not overrated. However, they are overrated in the way that most people traditionally do them.
Tell me more.
So I'm personally not a fan of sort of the rubric style assessment. So you have like pass or fail. I wasn't going to shit on anybody, but I'm going to. The FMS style assessment. So it's not just them that do it, but that type of assessment. I'm not a fan of that. In particular, when it is done with the means or with the purpose of trying to essentially create failure to drive sales.
Yeah, I agree.
Now, with that being said, while I think that the initial assessment process, especially how it's done in that commercial gym setting, I think is actually quite overrated. Where I think it's very underrated is how you assess on a daily basis.
Mm-hmm.
So I actually treat each session like each exercise as an individual assessment.
Mm-hmm.
So I think that assessing isn't a thing that you just do at the beginning to either make a sale or establish a baseline. It's something that you should be doing throughout the entire process with the client.
Totally. Yeah. So would you say that, I guess, traditional assessments, the way that they're often taught and used, it sounds like your stance is that they are overrated and perhaps even unethical, but the notion of assessing is something that you're not against and you're actually very for it and you do it on every single repetition.
Correct.
Yeah. Love that. I'm very aligned with you. Brett, what's your stance, man? Say something different.
No, I mean, like, I definitely agree with Ryan. I think there's a couple more kind of assessments, you could probably call them that I do like and I think are really useful. One is like a questionnaire or a conversation with someone, which I don't know if you call that an assessment. You're assessing their responses, I guess. And then the other one is athletic testing, because you've got a pool of fairly objective data that you can measure against for athletes of a specific age, or, level of fitness and level of their sport that you can kind of measure against and see where some gaps are. I think those are useful. Definitely assessing every day is something I do. But yeah, the physical assessments as you're like onboarding someone, you bring them in and then get them to do some like dumb tests that they're definitely going to like fall on the floor with, just so you can be like, hey, look at you fell on the floor. You really need me. I really don't love that.
Yeah.
Yeah,
go ahead.
Yeah, I was going to say, I'll agree and then disagree with Brett. I'll start with the disagree, which is that the word specifically has 17 S's in it. But no, I think actually Brett made a good point. I think that this is where, context is king. If you have either athletes, or I would say if they're, if you're training first responders or people who are, training for like first responder tests, those types of things, when there is like an objective standard to meet, I think that there may be a little bit more utility having like baseline assessments done just as a means of measuring, like just having some like objective data for performance. I think that changes, especially if you're working with Gen Pop, if you're working with even bodybuilders and stuff like that. I think that there isn't like a specific set of things that you need to assess, because I know Brett works a lot with athletic populations. If you've got certain things that you're using as standards to measure athlete performance, then I think that probably fits the bill a little bit more for some of those early assessment protocols.
Like, for an example, the Alpine Canada our national sport organization has a pool of data and benchmarks for specific movements and exercises that have some level of carryover to ski racing. So, and all separated by kind of like age group. So we can test a group of U16 athletes and say, okay, well, athlete A, you're, an 85% on the scale. There's some gaps that we need to do. You're strong, but your jumping dynamics are not quite there. Like you don't have that kind of like speed and tempo in your jumps. There's some work that we can do there. And so there's a big kind of pool of data to measure against, which kind of helps.
I could see how that could be useful, especially when you're dealing with a high volume of folks and maybe you don't have a lot of time to really individualize things and get into the weeds with each person, but rather leveraging these things as a snapshot of how they could perform, and specifically through the lens of athletics. Ryan, you said that you had a disagreement earlier. I didn't hear it. What was your disagreement? All I heard was you being like, yeah, we're totally aligned.
I said that I disagreed that the word specifically had 17 S's in it.
Okay.
He's just making fun of my stutter. It's okay.
Yeah. Okay, cool. Well, yeah, because I was listening, I heard that and I'm like, nice, coming in with the smoke. But I was like, but where's the disagreement? And I was like, no, we're completely aligned on everything.
I just make fun of people's deepest seated insecurities, and that's it.
Nice. I don't know if that's Brett's though. I think what would you say, Brett?
Oh,
is it the S's or is the?
Are you asking me
nails?
To share my deepest insecurity publicly, just for the whole
know,
world?
Maybe because I don't know if you've been looking at the YouTube comments, but there's 2 or 3 dudes that were like, "You lost me at painted nails," and I was like, "Why is this such a thing? People need to grow up."
I feel like those are viewers' insecurities that are manifesting themselves in their comments. Imagine this is. I feel like I'm gonna lose us a viewer or two here, but. Imagine feeling so insecure in your, I'm going to put this in quotes, manhood, that another person, I'm not even going to say painted nails, but the way that somebody dresses or presents themselves hurts your feelings.
Yeah, I know.
Come on.
Yeah, for sure.
Let's be real here.
For sure.
Anyway.
Yeah.
I'm actually cool dying on that hill. Never mind. If you're upset about that, check yourself.
Yeah. Yeah. No,
there's a John Mulaney bit about how middle schoolers have the insane ability to just zoom in on whatever your deepest insecurity is and just nail it. And he's walking across the street and some kid yells over, "Hey, that guy's got very feminine hips." And he's like, so yeah, I don't know. Maybe somebody in high school once said that I have a high butt. Maybe that's up there.
Oh, that's interesting. That's interesting. I'll share feedback I got. So and then I'd really love to talk about assessments. But there was a girl that I had a huge crush on in high school, and you guys remember MSN, MSN Messenger? On occasion, there would be surveys that would go around, and it would be just silly surveys, ranging a variety of questions. One of them was, when you think of me, what song comes to mind, or what's your favorite memory? Do you know what I mean? Stuff like that. But one of the questions was, if there's one thing you could change about me, what would it be? And of course, I send this to my crush, right? Because I'm looking to engage with her. She replies, I shit you not. She's like, well, your head is a little bit small in comparison to the rest of your body. So I'd probably make your head a bit bigger. I was like, fuck. And so since then, anytime I look at my frame, all I see is my puny little head in relation to my shoulders. But I'm actually kind of okay with it because, I think V-tapers are pretty sweet. But that was crushing in junior high.
With a massive head, the grass is not necessarily greener.
Yeah, that's right.
I follow a guy on Instagram who's it's totally unrelated. He's a woodworking DIY guy, but in most of his pictures, he just photoshops his head a little bit bigger, just imperceptibly as a gag. I love it. I love it so much.
That's funny. Make sure you send that to me. Let's bring it back to assessments. So okay. What are the pieces that we agree on? I think I'll name some stuff and then feel free to jump in. It seems like we agree that generally speaking, boxed assessments used on Gen Pop as a means of driving sales based off of inaccurate and false movement standards that create fear as a means of, once again, driving a sale, we are completely against. One of which that you mentioned, Ryan, that is really common is the FMS protocol. And there's a lot of other protocols that are very pass-fail. And all of those I really am very, very, very against. It seems like we are pro assessments, especially within an athletic context. You know, we talked about the assessments, Brett, that you use for the alpine ski team as a means of, I think if I am understanding correctly, kind of getting a good snapshot of, generally speaking, where are these kids at in terms of their performance and some of their performance qualities, perhaps, that would translate to sport.
Yeah, and we can see progress over like a workout phase and see if they've improved on those statistics.
Statistics.
Quit it.
Yeah, and interesting, and I'm happy that came up. For me, when we were kind of talking, when you guys were talking about the performance side of things, I initially thought of running, and like when I started working with my running coach this time around, he was like, "Great, 3K all out sprint essentially, and let's see where you're at, get some heart rate data, and using that as a means of informing pace recommendations for tempo blocks or what have you." And so I do think that, especially within an athletic context, that seems to be a really important piece. That, like, if you or even you mentioned first responders, right, or folks who are training to do police testing, where it's like, yeah, there are standards, objective standards you need to be able to hit. So let's measure to see where you're at, perhaps currently with all of them, using the test itself as an assessment, and then training as a means of then destroying that test later on. I think that all of that, you guys brought up some really, really great points there. And truly, I don't think I have much else to add other than perhaps a reflection, which is that at the beginning of our career, like right now, we've gotten in so many reps working with folks that we're very comfortable kind of going off the cuff. And, for me, I use my clients' goals as a means of driving the assessment, which I think we should probably come back to at some point, and how that can perhaps inform things that you look at, their injury history, et cetera. But at the beginning of your career, when you don't necessarily have that background knowledge, I wonder if assessments were used as a means of perhaps helping the trainer make initial exercise selection decisions, I think that can be useful. Mm-hmm. But once again, my line is that, assessments as a means of inferring wrongness about how people are moving based off of theories, and theories with a capital T, that faulty movement patterns equal like very predictably increased injury risk, which just really doesn't seem to be the case. That shit I'm against. I think that's all I would add.
So for Grid Gen Pop, I've had good luck seeing, and this is more on kind of like, taking a biopsychosocial view and seeing what movements people have discomfort with or fear around. Recently, had somebody who explained they had a history of back injuries, and we got to a point in this assessment that was kind of generalized for a gym that I'm working with. And I try to kind of keep it open because we've got a big group of people that come in, but there is some expectation from the clients that like there will be a physical assessment. So anyways, we can come back to that. But this gentleman said he had a history of back pain. I introduced like a hip hinge or like a Romanian deadlift to him, and he insisted on bending his knees and keeping his chest upright. And no matter how much I cued within that, 2 minutes we had, 5 minutes we had in that brief assessment, there was always some knee bend. And it was clear that like he was nervous around loading that low back. And that's, I think, good information to have going forward.
Yeah, I agree. Ryan, you were going to jump in, man. What were you going to say?
Yeah, so I think Brett kind of alluded to what I was going to say. So I think to me, the key with assessments, if we can sort of all agree that the fear-mongering pass or fail type assessments, throw those out. So then how do we say, okay, like if we're going to use assessments, how do we use them in a way that is actually effective and useful? So I think the key to me is it's all about data collection. And then it's when you're creating a plan for that assessment, it's trying to look forward and think, is this information that's going to be useful for me in the future? So for example, ETU said one thing, because this is very much what I will do, especially with the population that I work with now, because a lot of mine would be referral based. So they might come to me because I'll do a one-off session here and there with some individuals. And it might be somebody that's like, hey, Like, I want to train my quads more, or I'm struggling with a bench press. Can I do a session with you? Can you help me? So the assessment is going to be around exercises and or body parts that they care about. Like, I'm not going to test their vertical jump if we're doing bench press, right? So there's already some value in that time because I'm going over a thing that they've already asked and they've demonstrated that they wanted to see improved. And then from there, the way that I would look at the assessment is, so if we have a general idea of like some performance markers, I'm going to keep using the bench press as an example. So we know that there's, a requisite degree of like thoracic extension that we want, a requisite degree of retraction, a requisite degree of inter-rotation of the shoulder. Like, we've got an idea of some of the components of that movement. So then what I might do is I'm going to look at the movement as a whole. Like, how close are we to just like a reasonably good bench press that fits what their performance goals are? And then if we start to break it down, like, do they have the requisite capacity at each of those individual components? And that might be a way that you could start to use an assessment to just gain more information from that individual. I think what Brett said about like, paying attention to like, are they guarding a certain body part when they do a movement? Like, that gives you a lot of information as well. Yeah. So I think to me that is a really practical and I think valuable way of treating an assessment. Now, I would say if you're working with Gen Pop and they're, Bob that just wants to lose 40 pounds and feel good, like, he might not care about his bench press or his deadlift or whatever it happens to be. With that being said, I still think, so this is one thing I will say that I probably did pretty consistently across my career when I was still working as a full-time PT, is just looking at like squat movements. So a couple of things is in most cases, I'm probably going to do a squat movement of some sort with a client, like over the course of their training. Mm-hmm. So that already checks the box of like, this is valuable for me because I know I'm probably going to do something like this later. So some information that I gather from this assessment will have a practical application down the road. And I think the other thing as well, when we talk about the assessment, like the pass or fail thing, I think sometimes people can overinterpret that as like sales being bad. We've talked about this before. Trainers hate sales, but I think you can leverage good assessments and good coaching to improve your sales. So if I go, hey, like, I know that I'm probably going to do a squat thing at some point with Bob for his training. And when I go over his squat with him, my assumption for most Gen Pop is probably not great. I can tinker and coach with him and make some changes to his squat very quickly. That's going to demonstrate some value in my ability as a coach or as a trainer, which is going to get some buy-in from him. And the interpretation of that from the client standpoint, is much more positive. Like, hey, like, look at these things that we did. And like, your squat feels a lot better. And like, before when you would squat, like, you just felt your low back hurt. And now like, you kind of get the sensation in your quads. So it becomes a much more positive experience as opposed to when you put the dowel over your head and you lean forward when you did the overhead squat, you suck, you failed. Like, This is why you need to buy training.
I mean, it almost sounds like you're using that first assessment as essentially just the first session. It's like,
pretty much
great. These are the exercises that we're likely going to need to do. So let's essentially start taking some of these steps. And as opportunities present themselves to improve, exercise quality or technique as a means of driving load into certain areas or improving your comfort, I will coach you. And that's an opportunity, like you said, for you to highlight your skills and your usefulness of you being a part of their team.
Well, and I think the thing as well, I agree. And I think the thing with that as well is I think fundamentally it is a more client-centric approach.
Yeah, I totally agree.
I would say the pass or fail fear-mongering is a trainer-centric approach. Like, you're doing things to make money as opposed to you're doing things to help this client and improve their experience. And very likely the end result of that is they'll give you some money and then you'll coach them. Mm-hmm. But I think if you go into it from the perspective of not just this hour, but the hours afterwards, what can I do to elevate this person's experience on the floor?
Yeah, totally. Go ahead, Brett. You're going to jump in.
Yeah, just to go back to my kind of case study that I brought up, that gentleman with back issues. the conversation after that was, led very easily into sales was, we both saw that you were kind of guarding this movement. You explained that you had some pain around there. And avoiding that movement isn't really going to strengthen those tissues or bring you more comfort to it. And then you can kind of start to sprinkle in some pain science stuff in there and talk about how, like, your, fear and anxiety around the movement is kind of driving the avoidance in as much as like the pain itself and you can explain that we're going to load these tissues and strengthen them. And in time, both your comfort level, your, nervous system isn't going to react so strongly, and you're going to have the capacity in those tissues to be able to lift stuff without potentially hurting things.
Yeah, totally. No, I love that. So I had an idea and I just lost it because I only had 2 hours of sleep. I think that you mentioned trainers hate sales, Rye. And I think we've talked about this before on other podcasts. And I think it's really worth double clicking. Sales are so much more enjoyable and less yucky when you just focus on taking care of the client and you show them all that they can do in contrast to what they can't. And, the truth is like, you look at like movement assessments and whatnot, like the presuppositions of movement assessments are false. Like the presupposition that you need to have a certain movement quality as a means of not getting injured is very inaccurate. Like the human body is fundamentally adaptable, and generally speaking, don't do too much too fast too soon, and like you'll kind of sort of be okay. Introduce movement variability and Bob's your uncle, And so in contrast to, like you said, Ryan, I hadn't thought of it as, kind of cookie cutter assessments as being trainer centric in contrast to client centric. I very much agree with you on that. It's also bullshit centric, but that's a conversation for another day. If you focus just on like, what are the goals of the client? What's the data that would be good to collect on this first day? And then using that as a means of genuinely checking whether or not there's any contraindications, because for sure that can happen. And because one of the questions that I had kind of highlighted for today that I'd really love to get your take on is what's an underrated assessment that you swear by, or that perhaps you use that you don't see a lot of other people using? I have some thoughts on that. I'm curious what comes to mind for you guys.
One thing I wanted to say double click, and then you said double click. I was like, oh no, I've picked this phrase up from ET over the last couple of years.
For sure. That and pull on a thread.
There's a few. Yeah, there's a couple.
Juice to squeeze.
Juice to squeeze, yeah.
But one thing I wanted to highlight maybe a little bit more, and
double click.
We might be beating a dead horse here. Let's find out how many other phrases we can come up with. But I do think, especially, assuming that most of the people who are listening to this are trainers, and I would say the majority of trainers are kind of in the commercial gym setting. Mm-hmm. And I understand there can be a tug of war between management and sometimes what you think is the right thing to do. And that can be difficult to navigate for sure. I ultimately think if you do things with, again, the client's best interest in mind, at the very least, you can sleep easy at night. I think a good litmus test, if you have a certain assessment protocol, because I would like to add, again, I think we've talked about this with like rehabilitative modalities, rehab exercises. These are all tools in your toolbox that could be applicable in a given situation.
I agree.
Like some of the assessment movement, I pulled a breath there. God damn it. Some of the assessment movements that you might use, even if you don't treat them as pass or fail, like they still might be useful for you. So I think a good litmus test is like, are you ever going to train this thing? The reason why I'm comfortable using a squat is because I'm probably going to use a squat pattern in some capacity. It might be on a leg press, it might be on a hack squat, it might be body, whatever it happens to be, but I'm going to pick up some information from this thing when I see someone move for the first time that's going to inform further decision-making that I'm going to be working on with this, right? If you are doing a gait assessment and you are never going to, first of all, most people, I think, don't really understand what goes into gait, like how they should interpret gait assessments anyway. So they don't even have the requisite skill set to even be able to interpret that properly. But then they're not even, at no point in their training after that assessment, they're never going to do anything to address it. So throw it out. Like it's not useful for you going forward. same thing, like if you're doing breathing mechanics and at no point past that initial assessment do you ever address anything with breathing, just throw it out. Like, you're just not the guy or you're not the girl that's going to do that. Maybe they work with a respiratory therapist who does that stuff. Who knows?
Yeah,
But
that's a really good point. I love that you brought that in, like that those can be useful in certain contexts. And like, if you're someone who, I don't know, has a background, I don't know, whether it be occupational therapy or someone who specializes in stroke rehabilitation, maybe you would look at gait, but once again, I'm not one of those people, so I wouldn't really necessarily be able to tell you. So I'm really happy that you brought that in.
Well, and I would say, like, ET, you and I know him personally, but Mark, who we both worked with, is probably the exception in that, like, if a client who had a TBI or stroke or whatever went and worked with him, I'm confident that he has the skill set and the knowledge to do something useful with that information. And I've worked with that guy for over a decade, so I've seen what he does with clients. So if he did a gait assessment, I'd be like, I know that he's picking up information from that is going to inform his future decision making. I'll tell you right now, like, for me, it's fucking useless. I'm not going to do anything with that information. It's not my area of expertise.
Yeah.
So I think there's I hesitate to say, like, have some humility, but I think have a little bit of humility of maybe knowing the wheelhouse that you sort of kind of operate within.
Yeah.
And it is okay to not work on, like, it's okay to not assess things. It's okay to say, like, hey, this is just not a thing that I have the skill set to be able to deal with. So anyway, that turned into a longer rant, but I do think that a good litmus test is just like, am I going to use this thing in future training? If the answer is yes, it might be valid. If the answer is no, I would throw it out.
Yeah. Like, ET, have you done Romberg tests for people in assessments?
Yep.
So, like, I would trust you to, like, take that information and, like, get some use out of it, to put some more practicality behind Ryan's statement. But, like, there's a lot of trainers who, like, I'd be like, well, what are you doing running a Romberg test? Like, what are you going to do with that client afterwards to get any kind of, like, movement out of that test or, like, change out of that test?
No doubt. Yeah. So Brett, for you, like, I mean, both of you guys actually, what would be like, are there any specific assessments that you tend to use? Ryan, you mentioned like a squat just because it's something that is used just really often in training. Brett, I'd be curious to know what, if anything comes to mind for you.
Yeah. And if I can take this opportunity to like, one thing I wanted to mention in this was that I created an assessment protocol for this gym that I'm working with. And, they train everywhere from like, 8-year-old athletes to like senior citizens and even like professional athletes who come in there and train as well. So I wanted to try to create something that was open enough that could be used kind of for all these groups. So it's literally just like squat, push, pull, hinge. There's a few open ones. And when I presented it to the staff, it was like, if you feel comfortable doing a gait or balance analysis, if you feel that grip strength is something useful, because there's a good pool of data for especially elderly folk about, grip strength and motility and mobility and stuff like that and strength. If you feel comfortable, absolutely throw it in there. But let's just get the essentials, because, I'm not going to test a professional like hockey player on like a goblet squat onto a box. I'm also not going to stick an 8-year-old with a barbell on his back who's never seen one before. So try to keep some openness and allow the trainers to use their expertise to choose those movements. But, the thing that I tried to reiterate with them was that I think the biggest value in the assessment is an opportunity for a conversation with a client. And each one of these exercises, you can be asking them questions. Where do you feel this the most? Is there any discomfort? What happens if you try to drive the knee over the toe versus sit back on your heel?
Yeah.
There's a lot of opportunities to discuss these movements and get to know what people feel about them. Like, maybe they just like really hate squats for some reason. You won't know if you're just that trainer who's staring at them very, very intently with a clipboard in their hand, writing notes. So I encourage trainers to like, open up a conversation when those clients are doing those movements and afterwards throughout the set, because I think that's where you can get the most information and the biggest value, especially with Gen Pop clients.
Yeah, I love that. Ryan, you were going to jump in, I think.
Yeah, I think, to be honest, if there was one takeaway from this conversation, I think what Brett said there is probably the most important thing. is using these assessments to facilitate conversation with the client. Because ultimately, I always believe that the coaching process is collaborative. And the more that you develop that relationship with a client and that communication is really help ultimately their results, but certainly their experience is going to be better. To answer your question though, ET, underrated or like go-to assessments.
Yeah.
What I would say on the floor, my answer is maybe a little bit vague, but it is genuinely, I'm going to assess movements that I know that they're doing. So, I mentioned the squat because I think for Gen Pop that is generally applicable enough. But especially if I'm working with, these days, maybe more like bodybuilding clients, it might be, especially with them, because they already have like an exercise history. So they probably have movements that they struggle with or body parts that they struggle with. So I will want to see those movements that they have had difficulty with. And that's a huge part of the assessment on the floor. What I'll add, because I think that it's maybe we're essentially talking about assessments on floor, but something Brett said made me think of this. If you're working with clients remotely or like online, two things that I can think of that I will always talk about with clients and as a part of the not just initial assessment, but this idea of ongoing assessment, likes and dislikes, whether that is exercises, food. That's actually one of the things, one of the first things I do if I ever build out a meal plan is like, what foods do you like and what foods do you not like?
Yeah.
Because that's only going to improve their adherence. The other thing, a little bit more objective, but it sounds kind of silly. If you are working with clients in a nutritional capacity and you're not talking about poop, you're missing out.
Yeah, for sure.
I talk about poop with most of my clients, and like, once you get over some of the silliness of it, I'm immature. I'm going to giggle about poop too. It gives you a ton of information. There are plenty of people who might otherwise, if from the outside, you might interpret them as being these very fit, very competent exercisers, in whatever capacity it might be. And they are absolutely missing out on their full potential if they're having gut issues. And how they're
absolutely missing out on their full potential. Okay.
Yeah. That's what I meant to say.
I thought so.
But yeah, so I think if you're not talking about poop with your clients and the consistency of it, the color of it, all of that stuff, I think that you are actually missing quite a bit of information that is very, very useful.
Would you tell those trainers and nutritionists to get their shit together?
Yeah, exactly.
I had to jump in.
That's good. No, I love that. I think that that's great. I have an intake questionnaire that all clients, when they come on board, we talk about a variety of different things. Do they wake up with dry mouth? Are they thirsty, like really thirsty in the morning? Do they snore? Bowel health. So essentially, like on a scale of 1 to 5, what's the consistency of your stool? And then also frequency per day. For sure. There's a lot that can be gained there as a means of informing health and interventions. And I think that that's another one of the themes that is really important is they need to just be useful as a means of informing. It's like stop wasting people's time with things that don't matter to them and don't matter to you. So long as they are relevant to you and help you do your job and I think this is also important, that they matter to the client, then have at it. I think of a client that I just started working with. He had some concerns about his knees, and he wanted to, get, just generally speaking, stronger. And he had concerns about balance because he likes cross-country skiing. So I was like, okay, great. We'll just take a look at general efficacy on one leg or with narrow bases of support. So we looked at some balance stuff at some point during his first session. We also, because he had concerns about his knees, there are some assessments that I've learned over the years that look at the collateral ligaments of the knee, the cruciate ligaments of the knee, whether or not it's likely that someone has maybe some meniscal damage, et cetera. And so, using that as a means of hey man, yeah, we checked all these things. Your knees look rock solid. Fantastic. I don't see any red flags. Super useful for both me and the client because he had some concerns about his knees. And so it was an opportunity to actually check whether or not there was something maybe that I had to refer out. But then also when we cranked on his knees and he was like, things feel fine. It was like, great. I don't see any red flags. I think it's just about dosing the exercises, gradually and intelligently. And I think you're going to respond really well. And he was like, oh, thank goodness, So yeah, I think that that would be for me. I think that coming back to this question of what's an underrated assessment you swear by. So I like to check joint function. Like if someone's goal may require certain joint positions to just help them get into those like sport specific or goal specific positions, movements, I think that that's relevant, because fundamentally, if you can't go there with your joints, like if a joint doesn't go there, no amount of stretching, et cetera, can take you there. So I think that generally speaking, I take a slightly more kind of perhaps biomechanical stance when it comes to assessments. If someone's goals, whether they be performance goals or if their goals revolving around pain management, are joint specific, I'm going to look at those joints as a means of, potentially shedding light on things that I need to know, and also as a means of hopefully finding things that the client can do and decreasing some of their anxiety around loading some of these areas, which is also very, very, very useful. So I think those are my main additions on this point.
Yeah, I like what you said. I would agree with you on the sort of joint by joint approach. Sort of the same example of talk about like the bench press as well. Like any orchestrated movement is the orchestration of each of those individual components.
Yeah.
So if you deem there to be some kind of issue, or if you just want to have a better idea of it, if you just understand the individual components better, again, we keep kind of saying this, but that's just going to inform better decision making. The other thing I would add, again, I'm kind of thinking of this more from like an online coaching perspective, or like nutrition coaching, et cetera. I actually had a conversation with a client of mine this morning. In particular, if you are training female clients, especially again on the nutrition side, I would get very comfortable talking about things like menstruation, things in general, all the things that people kind of feel uncomfortable talking about from like a bodily function standpoint. Those are all things that are really useful to know. We've talked about poop and digestion, but like someone's menstrual cycle, really important. Even something, if you're ever working with like bodybuilding clients where they diet down and stuff like that, like even having that understanding of like what is happening with like their libido, it's a very private thing, but it is actually quite helpful to understand where they're at.
Yeah.
So all of those types of things, if we're talking about this ongoing assessment idea, those are things I think that you should keep tabs on. It just allows you to better understand the client experience. And ultimately, I think what this leads to is, not only does the client end up hopefully having a better time and has better results, but you as the coach, when shit pops up, because it's going to, like shit hits the fan always with every client, and will happen periodically throughout the time that you train them. If you've got a whole pool of data to pull from, you can make the right call or close to the right call pretty quickly and pretty confidently. If something bad happens and you have no information, it becomes very difficult to understand, like, where's the right direction? Like, where do I intervene? Who do I refer them to? Whatever it happens to be. If you have all of that information, you can just make those choices much more quickly and also much more confidently.
Ryan, can you give an example of what like something catastrophic might be with a client that requires that kind of information?
Sure. So I'll use an example. I had a client a couple of years ago who she had worked with another coach previously, and then I actually took over from her after her competition season. So she was a natural competitor, and essentially, so especially for women and in particular natural competitors, because they're not taking exogenous hormones, them coming back to baseline level of health can be a little tricky. I can't remember how long it was. It was well over 6 months. It might have been closer to a year until she actually essentially got her period again. But this was something that we had talked about quite a bit. And I sort of knew some of the stuff that she had done in her contest prep, which was very stressful. And from my end, us talking about what was going on with her from a menstruation standpoint, and then just in general, her energy levels, etc. But I would say in particular, what was going on from a menstruation standpoint, after we had tried a variety of things from a nutritional standpoint, I also knew fairly quickly there was a point where like it was outside my scope. So that allowed me to, and she is quite aware, so this was something she was sort of on top of anyway, but we very quickly came to a decision that, like, things kind of aren't moving in the direction that they should be. If we looked at, like, hey, these were some of the dietary interventions we made, and in the general case, you would see, X, and that just wasn't happening. So she had gotten blood work done, and essentially all of her sex hormones were just completely tanked. And she ended up working with a naturopath of sorts. I can't remember exactly what their title was, but through being referred to somebody else, she eventually regained her menses, and health kind of improved. That's a really common thing that you'll see. It's not uncommon to see women struggle to get their period initially, but it would started to get to the point where she was outside of the range where I thought it was normal. Like, it was taking so long, and she was still so low energy. I'm trying to think of how to phrase this. Like, she's a fan of the opposite sex, and that was not happening either.
Right.
So, like, those are conversations we were having. And it seems, again, like it could seem like a really private thing to talk about with a client, but it was actually really important. So it's like, hey, like, I knew she was somebody who liked going on dates and was very interested in like all of that stuff, and just cycle wasn't happening, wasn't interested in like hanging out with dudes basically. And I was like, okay, something is off here. And it all sounds really silly, but like that legitimately was something that informed the direction that we ended up going in, which was actually bringing in a third party. Other things would be, if we're talking about poop stuff, which is very important. Like, if you are constantly either like getting diarrhea or constipated, there's a strong indication that something's up. And you can do a variety of tests depending on what's going on. Like, you could do some home tests to maybe lead you in a certain direction. Like, I've seen like the baking soda test is one that you can do to test for like stomach acid, like if you have a sufficient amount of stomach acid, for example. But if you don't know what's going on with somebody's digestive tract, you might just delay intervention when you otherwise could have done something much quicker. It reminds me of, are you guys familiar with Tom Segura?
Yeah.
He's got this whole bit. I won't tell the joke, but he's got this bit where he talks about how he like realized at the age of like 38 that not like other people didn't have diarrhea every single day.
Right.
So it's like, if you're getting diarrhea every single day, like, get that shit looked at, literally. That's a problem. So I don't know if that answers your question, Brett, but like, those would be some case examples where I feel like this is turned into the poop podcast, but legitimately, like, that is something, if you are working with people in like a nutritional capacity, or if you're even just their trainer and you talk about that, I think it informs so much, and you can intervene much quicker. You can refer out much quicker. I think those are conversations that should be happening.
Mm-hmm. Yeah, I love that. For me, one of the elements that this really reminds me of and hammers home is just the importance of continuing education, because you think of at the beginning of your career as a trainer, even if you have a kin degree, like, it's very likely that you haven't had an exposure to the importance of like some of these other considerations that are perhaps non-traditional. And so continuing to invest in education, that solve problems, and also continuing education that helps shed light perhaps on just health optimization for a client. Because whether or not you're a bodybuilder or, another athlete, or just looking to lose a little bit of weight, like, health is a big part of that. And so I think that for me, what you were talking about there, Ryan, I was like, yes, I agree. And also, that kind of education is very rarely included in baseline certifications that trainers do, nor is it very often included in, kin degrees and stuff like that. So the onus is on the trainer to do everything they can to improve their skill set. So I really love that you brought that up. As we start to close today, I have a rapid fire question for both of you. So Brett, we'll go with you first. Top 3 mistakes that new trainers make with assessments. What comes to mind?
Things we've gone over before, treating it like a pass fail, like right or wrong. There is a right way to move. And if you're not fitting within this box, then we need to make corrections. And if not, you're going to get hurt. Actually, you know what? Forget the other 3. I'm just going to hammer in on that one, because it's still so prevalent.
This is why we're friends.
It's still everywhere. Like, well, if you don't move right, you're going to hurt yourself. I'm part of like a dad's group in Ottawa, and there's like a fitness dads chat. and I'll sometimes pop in on, people chime in and be like, oh, I let myself go a little bit. I really want to get back on the wagon. I'm in the West End, like looking for workout buddies or looking for a good gym or something like that. And like the amount of people that chime in and like ex-trainers and people who are just fit and are like, oh, you make sure you work with a trainer when you start, because if you don't have good form, you're going to hurt yourself. And like, I try to jump in there and I'm like, hey, listen, I'm a trainer. Like, I feel like I've got a good level of understanding, and like, please stop. Like, do not get into this from a place of fear. Like, your body is capable of so much. Just load it gradually and you'll probably be fine. Like, and just,
if you hurt, that's okay also. Like, it's just like, let's stop trying to avoid pain necessarily and accept that it is going to show up whether or not you're sedentary or not.
And like, being in a chat
just try
like
to be
that
smart with things.
Just feels like you're the one sane guy in an insane asylum, because like everybody there is like, what do you mean? You're a trainer, you prevent injuries. It's like, well, not really, like trying to like get this like really, here comes nuanced concept across to people who have a lot of experience in fitness and like they're fit people or they have been trainers and they've got this there's a word for it that's like
nuance.
No, it's like folklore wisdom or something like that. It's basically like you feel like you're wise because you've been surrounded by it for so long and have got all this old historical, factoids or whatever kind of like driving your thoughts, but like so many of them are flawed or outdated, and you're just not willing to like take a step back and say like, well, what if let's just entertain the thought, like form doesn't drive injury.
What if?
Thanks for coming to my TED Talk.
I like it. Yeah, it's a Brett talk. Ryan, how about you, man? Top 3 mistakes new trainers make with assessments. What comes to mind?
So I will say number 1 is what we've all said. Don't do the pass or fail thing. That is worth quadruple clicking on. The second thing I would say is don't be a completionist. And what I mean by that is if you've got an idea of the assessments that you want to do with a client, a prospective client, don't miss out on coaching opportunities on the floor because you think you've got to do all 5 or all 6 or all 7 assessments.
I see what you mean. Yeah.
Like that time on the floor when you're first with them, yes, of course you want to get information from them. But if we're talking about like assessments are an opportunity for clients to make, for trainers to make sales, sorry. And if you have an opportunity to coach that client and demonstrate a ton of value, like lean into that. So I have probably had times where I did a single movement on an assessment and they ended up buying training because that ended up being a really valuable thing for me to have done. I would actually say, in fact, I think that there is an inverse relationship between trainers that make sales and trainers that do a whole bunch of assessments. Some of the best salespeople I've seen with trainers, some of them don't even ever bring clients out on the floor. Which leads me to my third point, actually, is going back to one of the things that Brett said right at the beginning, or very early on, I think, is it is fine and dandy to have these great, hands-on skills with movements and exercises. But the assessment portion, what's really important is also just leaning into the people skills. Talk to people about their lives, like learn about them. So you want to gather information not just about their current status from like a fitness standpoint, but you also want to learn about their current status as like a human being. So those would be my 3. Like, don't do the pass or fail. Take coaching opportunities when they present themselves, but then also like lean in and listen and talk to people about who they are as a person, and not just treating them like they're a warm body that does squats and deadlifts and stuff.
Yeah, that's great. I think the only thing that I would add to that, because we've already quadruple or octubly clicked on,
I'm not a mathematologist.
Yeah, neither, especially not right now. Yeah, we've already talked a lot about just how false pass-fail assessments are, and so I think that like getting rid of those, I think, is really important. What I would add to what you guys said is leveraging assessments that are useful to your decision making, and also, once again, that are relevant to the client. So using the client's injury history perhaps as a means of informing some of the things that you may check for me, that's definitely something that I look into, both for my own data, but also as a means of the client's interest and also for the client feeling taken care of or for. So I think that that's important. Once again, their objectives. So for instance, if they want to be able to run, then maybe a running test would be useful. If they want to powerlift, maybe checking the power lifts would be a really, actually not maybe, checking the power lifts would be really useful if their goal is to powerlift, right? Rock climbing, okay, well, let's check, like, what can you do for a dead hang? How many pull-ups could you do, et cetera, et cetera, et cetera. Like, just really taking a client-centric approach, like you mentioned, Ryan, in contrast to a more trainer-centric, I'm going to check a bunch of boxes because this is what I was told to do, I think is really the way to go. Client-centric, 100%.
I'm going to call on your recall here, ET, because I can remember some of them, but not all of them. This is actually something that I think that the RTS program did a really good job of. I think they had, was it 5 questions to ask yourself about your client? Like, who are they? What do they own? Like, what do they, I can't remember exactly what all the questions were, but it was something I remember actually at the very, very, very beginning of the RTS program that I think are great questions to ask yourself.
Yeah, I think it was, who are they? What are their goals? And then HOT, what do they have, own, and tolerate from the perspective of what do they have from a joint motion perspective? What do they have ownership of over, meaning like qualitatively, do they have enough control, et cetera, over various joint positions and certain resistance profiles? And then tolerance is making reference to what's going to be the tolerance of their body. Like, are they, what's their training age, those types of things. And once again, it all comes back to like informing training decisions, exercise selection decisions. So thanks for bringing that up. I was actually thinking of those specific questions not long ago, and I was like, I can't remember. And I was going to go look it up in a book, and I didn't. So thank you for jogging my memory.
This might be rehashing our sales conversation. I'm not sure if I mentioned it, but I do like at the end of an assessment and conversation, just giving the client a little bit of something that they can take home and say like, okay, like here's the start of a plan. Like your goals are this, this, and this. We've got, pain around these movements, or we don't have the capacity to do these movements yet. So here's like, a napkin plan for how we're going to get from here to here. That you can take home, and like this is how I'm going to design the program. And I think that can be really valuable to show clients like, okay, like there's progress. I'm not just going to be showing up and doing squats every day. Like there's like a roadmap to get to where I want to go.
Yeah, 100%. Clients can feel really taken care of when they do that, and talk about a great opportunity to build trust. Hey, this is where you're at. This is where you want to be. This is a rough draft of how we're going to get you there.
And an opportunity, we talked about setting expectations with clients around progress. That's your opportunity to say like, okay, 3 months, we're going to try to get here. It's not going to look like this. It's going to look like that. And like that can be, a good opportunity to start peppering in these, thoughts and, incepting some ideas into clients who might take a little bit of time to kind of connect with those.
I love it, man. I think this is definitely a topic. I really enjoyed today's conversation, and I think that there's a lot more that could be said on this. So perhaps worth revisiting or double clicking, quadruple clicking. I don't know. We'll see. We can maybe pull on that thread a little bit more, but maybe there's some more meat on those bones, some more juice we could squeeze from it. I really appreciate you guys. Have a lovely evening. Folks, if you enjoyed this episode, please like, share it with your friends, family, your dog, whatever, anyone that you think would get a lot out of it. Thank you so much for everything today, gentlemen. I look forward to the next one. Cheers.
Adios.